out, hopefully to get the vaccine, and just kind of giving them, you have to sign up, you have to have an appointment, it has to be orderly. You just can't storm the Bastille.
So take us through what the process is in Maryland. And I don't know, we'll ask about how is it different in other states, but what is the process in Maryland?
So I think Maryland has a really good process. I think, Governor Hogan's rollout of how this is going to work is actually working. I hope that we get more vaccine from the federal government. I hope they release more so that Marylanders can see that this is a really good plan. But right now, you have to sign up. You have to make an appointment like you would make an appointment at your doctor's office. If your doctor's office has online capabilities, you go on, you pick an appointment. They ask you some pointed questions. And I think a lot of people.
To stop there. So do you go to your doctor's website? Do you go to a centralized website? Where do you want to start?
So you want to start with Maryland's COVID website. So they have a particular website, and that website will lead you to your county's page. Each health department and all of the counties in Baltimore City have a website, and you can sign up there. And doctors' offices have been giving a very small amount of the vaccine. I mean, minuscule amount of the vaccine. I wish we had more.
So the health departments have the most vaccine, is what you're saying?
Yes, and from
the county health departments.
From a population health standpoint, they are the guard keepers of population health. So that's the right thing to do, to give it to the health departments. The health departments have the wherewithal to set up large vaccination centers. They have the authority to do that kind of thing. But from a private practice perspective, I can tell you that my patients would prefer to be vaccinated by people who know them, who know their comorbidities, who will care for them if something goes wrong, rather than getting hassled. And there are a lot of scams going around. So please beware. Do not go to iwantashot.com or any of those kind of weirdo sites. Go to Maryland's COVID site. Go to your local health department site. There are people who are charging older people to make an appointment that they don't have.
So let's go back through. So there's a registration process, and as you described, it'll among other things, find out how old you are, but also I'll ask questions about some of the health challenges, the comorbidities that you might or might not have.
Yes.
Now, that doesn't give you an appointment, does it?
No. So what it does is kind of registers you, right? And if you're fall into a particular priority group, it gives the health department a chance to say, okay, so you have heart failure and you're a cancer survivor, but you're only 58. But you still qualify for 1B. So it gives them a chance to kind of sort who needs it most. And I know from an American perspective, we're not used to that. We're used to wanting what we want and going out and getting it. But in this particular scenario, it is always the best to take care of the people who are most vulnerable. So I think it's a good thing. Once they send you a little email that says, hey, make an appointment, we have these particular days and these particular times, make the appointment.
Let's just double back. You don't have to go back and recheck. They'll find out when your
priority group, if they're called
priority group at a time gets chosen. You'll get an email back, and then how much of a lead time do you get on that?
Well, for healthcare workers, we got 24 hours, but from what I understand from my patients is that they're getting, 72 hours. That's plenty of time to rearrange your schedule. But this is such a hot button issue. People are showing up early.
Sure.
Think of it this way. Think of it as boarding a plane. As much as you want to sit in first class, and it doesn't look like there are that many people, in that priority boarding group, there's no way that you're bumping the line. There's no way, unless they say, you're military, we have an extra seat, you can come on up. It's very much the same thing that we're doing now. But I can say honestly that sometimes when appointments are getting canceled, it's not because some nefarious reason. We're just not getting enough vaccine. There's just not enough at this point to go around.
So there's in effect a triage that's going on behind the scenes after you've registered to decide, what counts. Can you give us a sense of what counts more? Is it age? Is it disease? Is it? You've obviously mentioned the fact that healthcare workers have and we understand the reasons for that, but they get priority for that. Can you give me a sense of how that priority works?
So from what I've gathered is that they're following the same protocol that Governor Hogan has on the Maryland COVID website.
Right.
Is that older people, 75, people who have comorbidities, and not just hypertension and diabetes, but if you have heart failure, if your immune system is compromised in any way, shape, or form, HIV, AIDS, that type of thing, your propensity to catch COVID is much higher. So those are the people that we want to focus on. But this is not your time to tell the state of Maryland that you've got 17 venereal diseases and a hole in your heart to bump up to get this COVID vaccine. You need to know that all of this information is being tracked through Maryland CRISP like bacon, right? This is our Chesapeake region's information system for our patients, right? This is where we keep our information. This is where we have our prescription drug monitoring program. So we know when you're doctor shopping and trying to get pills from someone in Delaware and someone in Maryland and someone in DC. So we have this information, we have this data, the same place where we put our information, Immunet, about any other vaccine that you may get. So even if, let's say, you get a shot in Montgomery County because you work there and right. Things don't work out, it's time for you to get your next shot and you actually live in Charles County. You can get your shot in Charles because the information has been stored in Immunet and we know where you are. So there is a lot of surveillance and tracking that goes into this. In fact, while your arm is being prepped for your vaccination, there's likely someone sitting next to the medical assistant or nurse who's going to give you the injection, who's typing on their computer. They're putting your information into this government database. So we know where we are, who's getting vaccinated, who's not getting vaccinated. Right. And we can do some target marketing for those type of groups who are not, and make sure the people who are supposed to get it are getting it. We just wish we had more.
Sure. Now, in the Washington area, as it happens, I'm getting vaccine in Virginia later this week, but my primary healthcare provider is down in DC. Mm-hmm. Is that information shared regionally or is it just within Maryland?
No, it's shared regionally. So the CRISP program, the CRISP like bacon. This is the way that we remember it, not to confuse it with MD Chris, a campaign finance situation, right?
Which Don and you and I all have challenging memories. God bless them, but CRISP is good. Chris, not so good.
Don't bring them up. I don't even want them to know I'm here, right?
Okay, I hear you.
But so we call it crispy like bacon, so my staff can make the differentiation, right? This is a regional healthcare database. We call it a healthcare exchange, information exchange. So it shares information not only just in our region, but there's some other states, Kentucky and I think Pennsylvania, that share in this pool of data. So it does give us an opportunity to make sure that if you got one shot and you're, had a brain fart or had a funeral or something and had to travel and you don't want to be outside of your vaccine window, you could theoretically get that shot somewhere else if they had enough vaccine to go around. Unfortunately, again, there's just not enough to go around. And I know drug manufacturers are doing the best that they can to kind of flood the market. But when you think about everyone on the planet wanting this, it gives you pause. It definitely.
Well, and that is an issue because for the vaccines most of the vaccines are a two-step process. I mean, there may be, there's, how shall I say, we're on the threshold of having a single shot vaccine coming, but they've got to hold back inventory. I assume that's what they're doing. Well, I've heard, I'm familiar. They're holding back to make sure that they have the second shot, because if that doesn't happen, you really lose, is it all the effect? You lose the effectiveness of having had the first shot.
The effectiveness greatly decreases. It doesn't leave you without any effectiveness, but it greatly decreases. So Johnson & Johnson, a bunch of us at at MDGOP have been like, let's go Johnson and Johnson. Everybody's looking for that one-shot deal because that solves a lot of problems. It solves a lot of problems for people who may not have the wherewithal to travel to, Largo or to wherever to get a second shot. If we can get you to just get one, it would be really great. And the problem is that one shot has not been quite as effective with severe infections of COVID. I think it's like at 86%, but let me tell you, 86 beats the pants off of zero every single day of the week. Every single day of the week, 86% covered beats zero. So everyone's really excited about Johnson & Johnson coming to market. AstraZeneca is working on a booster, so to speak, for the South African strain. It's a different strain and it has a kind of a different makeup that they're working on something for that. And there are a few setbacks, but that's the nature of coming up with vaccines. They're, 2 steps forward, 3 steps back, 10 steps forward, and then you fall across the finish line exhausted but filthy rich. Should have studied biology. Studying microbiology could be my second pandemic, like the third one I should be filthy rich by the third one. But
so is the capacity building up? Are you getting more inventory? Are the pharmaceutical companies being able to produce more? Are we ramping up?
Yeah, so this is very much a use it or lose it type of prospect with these vaccinations. So, everybody who gets a shipment, you want to use it ASAP. I mean, you want to use it right now. One, because if it's the Pfizer vaccine, there's a limited lifespan on it, and you don't want to be the practice or the hospital that let 10,000 vials of, vaccine just kind of waste because you didn't want to give it out. So, people are vaccinating as fast and as quickly as they can. Hats off to Montgomery County. I can tell you when we went for our vaccines, it was clean, painless, very well organized. It was a beautiful situation. Even the area where we had to wait, the 15 minutes to make sure we didn't pass out from the vaccine was orderly. They had people kind of, there to help just in case things went awry. So I think that the rollout has been pretty seamless. When you think about the gravity of the logistics of this thing, the problem is capacity, and I think the drug companies are doing the best that they can with what they have. Again, this is not just an America thing. This is a worldwide problem. And as we get more and more, and we are getting more and more, as we get more and more, doctors' offices will be able to help patients a little bit more when we get more vaccine. And I know that there are going to be more vaccination stations across the state that open up.
So as we ramp up production, I'm trying to get to the point of, I guess one of the questions everybody has is when people reach a critical point of, I don't know if it's necessarily herd immunity, and we should probably define what that is. Mm-hmm. At what time do you think this year could we see more normalcy of large numbers of the at-risk people having been protected, people who are also reaching the public?
I think, and I'm very optimistic, I think by mid to late summer, we should be good to go. And people say, oh, you're crazy. But, I have this faith in my industry. I really do. And I can tell you, once we have enough vaccine to where health departments can put it in the hands of the professionals, put it in the hands of the primary care doctors, it will change how quickly this happens. This is not to denigrate the people who are given the vaccines at the vaccination stations, but physicians' offices give vaccines every day. It's what we do. So there is no training ramp up for us. We have to run out and get the supplies. We're just waiting on more vaccine. And it's frustrating on that part, but we do understand that this is a global problem, and these companies are working at mass capacity. I get several kind of blogging newspapers. One is Fierce Healthcare, and almost every day there's 2 or 3 articles about, AstraZeneca is working 24/7 and they hit a wall, but Team B is doing the same thing and they're doing great. So they're at capacity. Everybody's pushing as hard as we can. If we could practice a little patience, and I know that's hard to hear when there are people dying, and I'm not.
And much of the process right now, as we've already talked about, is in that triage of allocating a scarce resource to those people who can use it the most. So let's say, pick a time 90 days from now, and again, I'm the glass half full like you are. 90 days from now, we will have hopefully gotten people with large numbers of comorbidities, large people above a certain age, and have more flexibility as to the categories that people get it. It should be a little easier to be able to do that.
I agree. I think it's hard for Americans, and I say this. I said this webinar with a bunch of Canadian folks. It's hard for Americans. It's not who we are. For us, if you are wealthy enough or powerful enough, you can get what you want, right? If you live in the right county, Montgomery County is absolutely the right county, right? You should be able to get what you want. But this is a situation where your wealth and your power have no part in this. This is all about getting this vaccine to the people who need it the most. So this is kind of a cultural, slap in the face for a few folk, but I think it's a growing process, the maturation of the American public, and I'm all for that. I'm
Although at some point, again, that universe ends up expanding.
Oh, absolutely.
Right,
And then
and
we'll be right back to where we usually are, where people will be storming into my office demanding the vaccine, and I will be, telling them to roll up their sleeve and happy to give it. So once we get to that point, where there's enough vaccine for everyone to have a supply who would like to do vaccinations, I think it'll go so much faster and so much quicker. We just have to get over this one bumpy part of the road, and we're in good shape.
Now, it may be worth. I mean, we took, obviously this pandemic has had just a blizzard of numbers, and we've been throwing numbers at people left and right. And I wanted to kind of, you have a lot of experience with vaccines. Let's talk about what does 90% mean, and again, 90% effectiveness. And for example, how does that compare with the flu shot?
So, 90% is outstanding. Let's just put that out there. 90% is outstanding. And people, there are a lot of closet, doctors now. I call them Facebook doctors, Facebook immunologists, people who corral information. But there's a reason why we get a flu shot every year, right? Diseases mutate, viruses mutate, and there are different strains, and that's what we're experiencing now. There are different strains that are becoming on our national stage. There's a UK strain, a South African strain, and before it's all said and done, there'll probably be 4 or 5 other strains. So we're going to have to continually develop vaccines that kind of fight off that one, this one, and this other thing. So 90% effective against one is outstanding. Our flu shot, if we can get a really good idea of surveillance of what's going to happen next year, again, because you don't know what the next flu season is going to be. You don't know if it's going to be a lot of flu A versus flu B. You're kind of good guessing based on the numbers and the trending, and it's not an exact science. It really isn't. But if you can get 86% against this new flu that's coming, the world is happy with you. So 90% is outstanding. You should not be ashamed at 86. 86 is still outstanding. When you think about the millions of variations, and we say 86% of these you're protected from, that's amazing. And to think that they did this in less than a year,
And now, in some years, by comparison with flu, it can be as low as 50%, right?
Depending on the variant,
Right. Sometimes lower, but they target at least 50%. And what that means is that you're just, if you had 2 shots, 2 potential exposures to the flu, one out of those 2 times you wouldn't get the flu, and the other time you would. So I've heard folks say, well, gee, I got a flu shot and I got the flu, so what's the point? And the point is, out of multiple years where you get the shot, you're less likely to do that. I just got a note from somebody who's in that category. It doesn't, but anyway, that's the advantage is probability. But 90% means obviously is a very high number, and is that much more effective.
It's an astounding number when you think about it. So, I've been in healthcare 25 years. I've had 25 years worth of flu shots because it's mandatory.
Right.
The health nurse, when you work in the hospital, they don't even ask you. They just come up, rub you, jab you, and be like, okay, check her off the list. She's got the flu shot, right?
Right.
I've caught the flu twice. Although 25 years of flu vaccine, I've caught the flu twice. Once, probably early on in my career, I think I was working in ophthalmology. I think I got it from some little kid. Little kids, they look like they just have the sniffles. Adults catch it and it, almost.
Their little kids are petri dishes of everything that you don't want to have anything to do with. God bless them, but anyway.
They are so resilient, and I felt so bad because I was so mad at this kid's mother. I'm like, oh God, don't you dare bring him back to the office. He almost killed me. And most recently, probably 2 years ago, and I really thought that I had a very serious respiratory illness because I couldn't stop coughing. And when you have a cough, it makes everything else not work right. So I was in the office, I did some coughing and passed out at my desk. And, my staff at that point called 911 and they're like, I'm fine. I just had a cough. I get to the hospital. I have flu A and it's horrible. So the two times I actually had the flu, it was absolutely devastating. Fever.
And you had taken the shot. It's just
absolutely, but
that's the probability. Yes, that's the issue of the probabilities.
It's like winning the lottery. 25 years worth of shots, and I hit the Powerball of flu. It really is that thing. So you can't blame the flu shot. It's not designed to protect you from every possible variant. In fact, the fact that it protects us from some variants when they're looking into the next flu season, like now, as Sanofi is talking about. How many flu shots do you want for the next flu season? Well, we're still in this flu season, but I'll take 1,800 just to be on the safe side.
Mm-hmm. So let me just take you through a little bit of the process. Now, once you've taken the vaccine, the recommendation is that you still need to wear a mask.
Absolutely.
Can you explain a little bit about that? And obviously, there is a period of time. Well, let's go take it in steps. How that all? Why is that? You can explain that.
So the first shot does not make you immune.
Right.
So wearing the mask protects you from other people's respiratory parts, right? So that's the beauty thing of, well, at least your mouth and your nose, not so much your eyes, but protects you from that. So the first shot does not make you immune. So you have to get the second shot within the time window. If it's the Pfizer, I think it's 3 weeks. If it's the Moderna, I think it's 4 weeks time period plus 3 days either side to have that second shot. After you have the second shot, you still need 4 more weeks before your body starts to produce the protein to protect you from COVID-19. So even now, even though I've had all of my shots, I laugh and say I've got all my flea and tick shots, right? So I had all my shots at the end of January. Here we sit in February and I wear a mask everywhere I go. As an asthmatic person, I wear a mask every single where I go. My office has been fully immunized. We dress in full PPE every single day. It's really just not, for us, because we're so high risk, it's really not worth the risk at this point. Now, once we get, maybe late March, I'm sure my staff will start to revolt a little bit going, hey, we've got some immunities. And the answer is going to be, well, what about the South African variant? What about the UK variant? We have to be very smart with this COVID thing. The last thing we need is a bunch of new strains that we are not prepared to protect people from. So wearing the mask is a good idea. And that's coming from a Republican.
So that's the 10% / maybe higher with the new vaccines, rather the new variants coming in. Now, when you get a vaccine, did you get a certificate? Can you get on a plane? How do you?
Yeah, they give you the little card. So it's I wish I would have brought mine so you could see it. It's a little tiny card, maybe a quarter of, here, and it just says that your name, your date of birth. Sometimes it's a lot number sticker from the vaccine that you had and the date of your first shot with a signature, and a second date with the signature. And people are using that to travel. Although I'm assured, I have some friends that are traveling internationally, they still have to pass the rapid COVID test at the airport to get onto the planes anyway. But I'm thinking people who like to cruise, maybe this might be the thing. If you can prove that you've had all of your shots, For healthcare workers, it's a lot easier than keeping those little cards. I'm keeping mine for posterity to prove to my grandkids, you know, look what I had to live through, you know. But we can just download your shot history from Immunet, and every vaccine that you've been given is listed there quite plainly. But I think it's, you know, a good keepsake from living through this pandemic.
So I'm going to turn the tables on my co-host, Don Irvine, and ask, Don, now, do you get a flu shot every year?
No.
Okay.
I've never had a flu shot.
Never.
Never. I will say, I was actually at the doctor today to check on my shoulder for something else. And they asked, and I asked him if he recommended. He said yes, but he said at the same point in time, since we're nearing the end of the flu season, it was really up to me. So I said I wouldn't do it. You know, what I'm doing is I'm waiting for eligibility for the COVID shot. And he said, you know, if you get the flu shot and then you become eligible for the COVID shot, he says it complicates things a little bit.
You have to wait 2 weeks.
Single shot because of my age, and so I was like, I've got all these things now floating around.
It is definitely new and exciting for people who are like Don, who are not accustomed to being vaccinated. So this is like a whole new language and landscape. So I have a lot of people who are like Don, who haven't had a flu shot, and they thought, what do I need a flu shot for? I have to stay home for work. You know, I'm at home with the kids. I have very little social interaction outside of my bubble. But now they're interested because some things are opening back up, you know, restaurants and that kind of thing. But 2 weeks, we want you to wait 2 weeks in between. For them, it's too much of a gamble, because if you've already been registered and your name is, you got an appointment, you don't want to risk, you know, they have a shot for you, but now you can't have it because you were fooling around getting a flu shot. So it's a catch-22. Congratulations, Dawn, on staying healthy. And missing all of those flu shots.
It made it 61 years, and so far so good. But yeah, but COVID is, you know, changing my perception of things.
It's really interesting. So all of our SARS illnesses, and COVID is a SARS illness, you know, they've been working on base vaccines for SARS for years, right? So this is not, you know, they didn't wake up one morning and go, haha, we have a vaccine. They've been working on it for a very long time. But I think the progression of SARS, it's getting closer and closer. So there are fewer years in between these illnesses. So learning this new landscape and learning the new language of what vaccine you can have and what can piggyback with what and that kind of thing. Unfortunately, I think that's pretty much here to stay. But if you learn it now, you'll be good to go for the next, you know, thing that's coming.
You know, and just to say too, you know, all this has been a great discussion. I think it's just that I see from my vantage point as just an ordinary guy or whatever, is that, you know, we have this massive influx of people trying to get this COVID shot, and you know, and you talked about just, you know, the people and their various reactions, the older people and whatnot, but I don't hear really a whole lot about what happens 6 months, 12 months down the road, because you've mentioned we're already getting variants. So, you know, and when we've had people compare COVID to the flu, but I really haven't heard a lot about comparing COVID to the flu to the extent of, by the way, you get this shot this year, we may have a different shot for you next year because we've had other strains come up, you know, and so I haven't heard that really being addressed too much at this point, if at all.
Yeah, they don't want to scare folks. I mean, I think that's, you know, I think the populace is already, you know, shook. You know, people are like, oh my gosh. And if we say, listen, you get this shot and it's going to give you some immunity for maybe the next 6 months, and then you have to wait in line again and, you know, schlep over to Six Flags and get shot again. It makes people feel like we really don't have a handle on this. And I can tell you that diseases are tricky. Viruses, very much so, are very tricky. They mutate. And sometimes, when you think back to the people who survived the first flu, you know, and how devastating that was. Now we think of the flu shot, and there are people who are saying, I don't need a flu shot. You know, there were people back then who would have killed their mom to get their hands on that flu shot for themselves or their children. So we're just living through that cycle. You can almost rest assured that there's going to be a variant. You know, we have definitive proof that there are going to be variants. And there'll probably be a COVID shot, kind of like a flu shot.
I mean,
hopefully we could get it at CVS though, right?
Yeah, well, you can get almost everything at CVS. They're starting to have primary care doctors at CVS now, and Walgreens is, people ask me about that all the time. And
I'm sorry, and not that you shouldn't go to your clinic in Tacoma Park.
Oh, listen, you can come to any of my clinics. We see about 85 people a day, so we're super busy. We're super busy, and I can say that all of our population health education that we've been doing with the people who live in and around our offices has worked really well. I mean, we've sent them massive email blasts, especially people who are diabetic because of their metabolism.
Right.
We want to hear from you. We'll call you on the phone. We'll talk to you. We'll do anything that we have to do to make sure that you're good. And that's paid off. Yeah.
I'm out of state. My mother is out of state. She's up in New York, and she's 87. And she doesn't want to. She spends a lot of time on computer and Zoom calls and all that, but she doesn't want to take the time to sign up, which is frustrating. And I was pushing her on it, and she's a CPA, and she said, "Well, it's tax season."
Yeah, it's her Super Bowl. This is her time of the year, right?
Right. I'm like, Mom,
Stanley Cup.
You got to get the shot. Come on. It's like,
you want to get to the next tax season, Mom.
Right.
You want to get to the next tax season.
Listen,
there's a serious question there. Is what about the role that family members or other support people can have in encouraging folks who should sign up? How does that work?
That's a tremendous question. This is what we talk about when we talk about patient education. My practice, I could send emails to my patients, 1,000 emails, 1,000 text messages, and they go, "Oh, it's Coley," and they just swipe it. "Oh, what does she want?" But right. All I have to do is send an email that says, "Dr. Eric said, come and get your flu shot." And then we've got a line of people down the hallway to come and get their flu shot. So we use his center of influence to kind of leverage our patients into doing the right thing. Doctors' offices especially, because your mom likely has a very good relationship with her care provider and with her children. These are people who are saying, "Listen, I need you to get this shot so that we can scratch it off of our list and you can move on with your life." And I think that's the right thing to do. Additionally, I need family members to be very proactive to make sure that your loved ones are not putting their personal information into some of these, sidewinding websites, getyourshot.com, or the very creative scammers who are calling old people saying, "Oh, you missed your appointment. Give me your credit card information and I'll make sure that we can save you a spot." And that's happening. And that is so heartbreaking. People are just so low sometimes. These are people who are fighting literally for their lives, and yeah, you're scamming them for whatever little money they have left on their credit cards during the middle of a pandemic. There's a special place in hell for you at that point. But we have to be very careful with our loved ones, especially older people who are strong and independent, because they're not going to want to hear you say, "Mom, don't answer the phone and make an appointment," because she's going to say, "Listen, I know what I'm doing. I'm your mother. I'm a CPA. I know how the world works." Please be very careful.
Let me tell you, I have no worries about her. She is.
She's got it. That's fantastic.
She's got it. Yeah, no, she's, but and part of her feeling is she's very, very healthy, and she's not going out, and there are other people who she knows she feels should get the shot first.
There's a lot of that going around. In fact, I was on the phone last night with a dear friend of mine, and she lives in a multi-generational household, and a couple of those people in that household are priority 1 people. And she's like, "Do I just stay in my room and stay away from them? I mean, how does this work?" And I said, just keep living your life, because you're a part of their bubble. And if you haven't killed them off yet, there's very little chance that you will now. But she goes, "Listen, the next time you get some of that vaccine, we'll have a party at the house and we can just vaccinate everybody who shows up." And I said, "That's a great idea, except for I don't want to go to jail. Orange is not my color. I don't want to go to prison." I think there was one state where there was a guy who stole some vaccine from the hospital to vaccinate his family members and friends, and he went to jail for it. Rightfully so, because at that point, you're not being a team player. But, I don't want to be, on the front page of the Washington Post saying, Nicole Bennett had a Mary Kay showcase / COVID vaccine party, somewhere in Montgomery County. Although I think it would be a very interesting article.
It would be an interesting thing.
Well, I think there's a lot of people who would do that, in healthcare, that if it was plentiful enough, we would drive door to door and make sure that everybody got what they needed. I've done that personally with friends of mine who were thinking that they were sick and had small children or older people who live with them. And when I got that first rapid COVID machine, it was like liquid gold. I carried it around with me in my pocket and that kind of thing. So you're like, I think someone's sick. I'm on my way. So I hop into my car, I'm driving, and I get there and, I'm swabbing everybody's nose and testing everybody. And they're like, you're a maniac. I said, no, I've got 2,300 other tests I can do on this machine, but they go like that.
So Nicole, that is a rather, we're coming up on the end of the show, but that was a very optimistic note of being able to go door to door to do the vaccine and having enough down the road. And actually, that's probably going to happen sooner than we realize. Obviously, we want to get people who are the most at risk vaccinated first, but we will be reaching that point where essentially there's enough vaccines where anyone who wants it will be in a position to do it, and we'll have a population that has that, and who knows what will happen. Maybe we'll get Don every year to get his flu shot and his COVID shot.
I don't think we're ever going to get Don to get a flu shot. I mean, he's made it this far. He's. I think if you've made it to 45, maybe 50, and you've not had the flu shot and you're good to go, I think you're pretty good. I think you survived it. Just stay away from small children, toddlers.
Yes.
Avoid them at all costs. But otherwise, I think the COVID shot is where everybody, the focus is going to be in maybe the next, 5 or 6 years, and making sure that you've got your COVID shot.
Well, thank you very much, Nicole. We really appreciate your being on, and obviously we'll be having this show up on YouTube on our channel, but it's also available on the Facebook page. Thank you very much.
Thanks for having me, guys. I appreciate it.